Hi there and welcome. I'm here with Dr. Jane from Rockside Family Dental Care. Hello, Jane. How are you today?
Good. How are you doing?
I'm doing well. And
Good.
what we're going to talk about today is apparently, if people are going through cancer treatments, they can develop dry mouth. And I was wondering if you could maybe talk about that and what are some things they can do to get around the negative effects of that?
Yeah, so it's very common whenever someone is diagnosed with cancer that they're either going to be treated with chemotherapy or radiation or a combination of the two. And it's super common for people to develop dry mouth, even if their whole lives they didn't have that. Chemotherapy, for whether it's taken in pill form, IV form, often leads to that. And with radiation, especially whenever it's anything within the head and neck region, you could have salivary glands that are damaged. And the big problem with dry mouth is it leads to rampant dental cavity formation because of the fact that you no longer have your saliva. Your saliva is very protective against cavities, and it would be a huge shame for someone to develop a lot of cavities on top of having to endure cancer.
Yeah.
So it's very important if you are diagnosed with cancer to get a thorough dental exam. I know that's probably the last thing on their mind, but we just want to help prevent having an additional side effect to their treatment.
Okay, well that's good information because not anything, and are there things that you can actually, or treatments or products they can use if they have the dry mouth?
Yeah, so you've got your standard over-the-counter mouth lubricants. Biotene sells it. That's helpful, drinking plenty of fluids. But in addition, it would be smart to, especially if you're getting head and neck radiation or having combination of radiation chemo, to get what we call fluoride trays. We make those for patients who are at higher risk of developing cavities. And so what we do is we take impressions of your mouth, we fabricate trays that are customized for your mouth, and we give you fluoride in a higher concentration than what you'd find in a fluoride mouth rinse or toothbrush at the store, so that this helps combat the effects of the dry mouth. And then a little trick that one of my professors at Ohio State gave us is whenever patients are in this situation, a good way to also help negate the effects after you eat, let me back up. After you eat, your mouth becomes more acidic. And if you have dry mouth, it makes it harder to combat the cavity. So it would be a good idea to dissolve some baking soda in a bottle of water. Just swish around with that. That makes your mouth more basic and helps as a preventative way also.
Funny enough, Dr. Jane, I remember my grandmother used to, the baking soda thing, which I never understood. She'd brush her teeth with it, and I guess now I understand why. I get wisdom and all that, but
it doesn't taste very good, but it does help.
Well, that's a lot of good information, and thank you for sharing that with us. And this is what the folks at the Rockside Family do. It's about oral care, but I mean it's about total health, and that's what they're there for. So, hey, if you want to see some more videos, informative videos like this, you can always do it on their website, and that's at rocksidefamilydentalcare.com.